Good morning. I am Dr. Karthik Yelamarthy, consultant spine and orthopedic surgeon at Uday Omni Hospital. Now I am here to discuss something about cervical spondylosis, a common problem which patients complain of. So, what exactly is cervical spondylosis? It's not a disease, but it's an age-related issue of the spine, like a normal aging process, like every body part ages. So the aging of the spine is called spondylosis. So when it affects the cervical spine, it's called cervical spondylosis. So what exactly happens? Our spine is a stack of 33 bones like which are articulated in the front with the help of intervertebral discs, and behind there are joints, facet joints, and there are ligaments connecting the bones. What happens is with age, due to the alteration of the biochemical structure of the disc, it gets dehydrated and it can't absorb the forces in a normal way. So the material which is present in the disc, the nucleus pulposus, gets herniated backwards where we have the nerves. So then the problem starts. So what exactly are the symptoms for cervical spondylosis? Because as I said, it's an age-related issue. Majority of the people don't have any symptoms. So among the people who present with symptoms, the common ones are neck pain and stiffness of the neck. They can also present with a referred pain to the face, to the anterior part of the chest, between the shoulder blades. So this is all referred pain to the degeneration of the disc or facet joint. Sometimes the chest pain may be so severe it mimics the anginal pain. So sometimes it's called as cervical angina. So what are the other less common symptoms of cervical spondylosis? They are because of the pressure of the herniated disc on the nerves. You get sciatica type of symptoms in the upper limb. It's upper limb cervical radiculopathy. So you get numbness, tingling in the hands, in the fingers, and all. So when the disc or the herniated material presses on the spinal cord, you get symptoms of the spinal cord compression, what we call as myelopathy. So what exactly happens in myelopathy? The cord gets damaged. Initially there will be cord edema, and later the damage will be permanent. It's called myelomalacia. So how can a patient present with myelomalacia? So he'll be having initially loss of hand dexterity, means he will not be able to perform fine tasks with the help of his hands, like he'll be having change in handwriting, difficulty in buttoning the shirt, and difficulty in eating with spoon. So he'll be losing balance, like if we are to wash his face in front of wash basin, once he closes his eyes he may lose the balance. Also, people with myelopathy have bowel and bladder issues. They'll be having increased urgency of the urine, increased frequency, and in severe cases they'll be having urge incontinence and sometimes severe bladder retention. So what is the treatment for this? So as I said, it's an age-related issue. Majority don't present to the hospitals, and majority don't require any treatment. Among the people who present to us with common symptoms, they get better with a good sort of conservative management. What exactly is the conservative management? Conservative management includes medication, physiotherapy, and some exercises. When I say physiotherapy, it includes both modalities like deep heat therapy, interferential therapy, short wave diathermy, ultrasonic therapy, and cervical traction. So the second part of physiotherapy is neck exercises, which include neck stretches and isometric exercises. So medication include the routine over-the-counter NSAIDs, some analgesics, and some membrane stabilizing agents like gabapentin or pregabalin. So these are all temporary relief measures. For a long-term relief, people need to change their lifestyle, their work ergonomics, the way they work on the system or desktop or a laptop. And who require treatment for cervical spondylosis? As I said, majority of the people who don't present to the hospitals, they don't require any sort of treatment except for change in lifestyle, regular neck exercises, regular aerobic conditioning exercise, and all. So do the people who present to us require like Majority get better with conservative management, which includes physiotherapy, medication, and some exercises. Physiotherapy include deep heat therapies like short wave diathermy, interferential therapy, ultrasonic therapy, and TENS, and cervical traction also. And among the medication, the commonly used ones are over-the-counter NSAIDs and some analgesics and some membrane stabilizing agents like gabapentin and pregabalin. So majority of the people respond to this conservative management. Among the people who don't respond to the conservative management can get further treated by epidural steroids or nerve root blocks. So who requires surgery? Not all patients with symptoms of cervical spondylosis require surgery, but there are patients who mandatorily require surgery. Those are patients with persistent, consistent pain and weakness of the hands or limbs due to the damage of the nerves, or people who are having bowel and bladder issues, who are unable to walk, who are losing balance. As I said, who are having cervical cord damage, ongoing cord edema or myelomalacia are candidates for surgery. So what are the types of surgery for cervical spondylosis that we offer? So surgery can be done from front or from the back depending on the site of pathology and the number of levels involved. So usually we do a fusion surgery, and from the front we will do a discectomy or a corpectomy and fuse the spine from front. We put plates and screws. From behind we do a laminectomy and put fix the spine with lateral mass screws and fuse it. So what all need to be done after surgery? So there is a common myth that majority of the people think that once spine surgery is done, the life is over, that is the end of the life, and they can't do any sort of works or something like that. But it's a myth. So post surgery, immediately in the first or second post-op, will make the patient walk, and he can climb stairs, he can sit on a chair, and we give them cervical collar, a hard cervical collar for the first 3 months to allow the fusion to take place. After these 3 months, they can take off the collar, do the regular neck exercises, and immediately after surgery also they can start walking. As I said, they can get into daily course and daily activities in a couple of months. So what they require post surgery, or any person like to prevent recurrence of symptoms? So they should change the lifestyles, they should change the way they use their gadgets and regular neck exercises. So all these things, all these measures help people to combat this majority of this lifestyle disease.